Patient Assessment. Secondary Assessment. This video will demonstrate the completion of a secondary assessment as part of a patient assessment. Obtaining baseline vital signs. If no critical findings are identified in the patient during the primary assessment, then you should continue with the secondary assessment. In a critical patient, start the secondary assessment during transport if time and the situation allow. Never delay the transport of a critical patient in order to perform a secondary assessment. The first step in performing a secondary assessment is to obtain a baseline set of vital signs, which includes the patient's pulse rate, strength, and location are measured for 15 seconds at a minimum. The patient's ventilation rate and depth are measured for 15 seconds at a minimum. The patient's blood pressure. The condition of the patient's skin. Sample history. Next, obtain a patient history from the patient, family members, or bystanders. The sample mnemonic is a useful tool when gathering a patient history. SAMPLE stands for signs and symptoms, allergies, medications, past and pertinent history, last oral intake, events leading up to this situation. Whenever possible, a complete and systematic head-to-toe physical examination is performed. This portion of the secondary assessment is adjusted and completed based on the patient's signs and symptoms and the mechanism of injury. During the head-to-toe physical examination, palpate, visualize, and auscultate the following body parts as indicated: head, neck, chest, abdomen, pelvis, back, upper extremities, lower extremities. During palpation, continually check your gloved hands for bleeding. In pediatric patients, reverse the assessment. Start at the pediatric patient's feet and move up. Next, perform a detailed neurologic examination that includes the Glasgow Coma Scale. If the patient's condition warrants, cardiac monitoring and pulse oximetry may be included as well. Finally, package the patient appropriately for transport to an appropriate facility. Provide spinal immobilization as necessary based on the combination of the patient's mechanism of injury and the findings of the secondary assessment. During transport, reassess the patient's vital signs and compare your findings to the patient's previous results.